Promised you today. I've been promising for a while. I've been boasting and bragging about the health care here in monta, Ecuador, because that was one of the things I had to check off my list. I wasn't jumping out of the frying pan into the fire by no means. I wasn't leaving the U.S. unless I could improve the quality of health care and the accessibility and affordability of health care. And I thought there's no better way to prove that than to have these feature one of Monta's prominent doctors, who happens to be my doctor and a doctor to a lot of the expats, because she speaks excellent English, yet she's Ecuadorian. So that's kind of one of the first questions that I'm going to ask her is, where did she learn to speak such excellent English?
Well, hello everybody, and thank you for having me, Deb, here on your channel. It's a tremendous pleasure to be here with you. So it's a very funny story because actually my mother, she was a trained nurse. So she traveled around the world doing mastering and specialty studies. And she came one day and she sat me in front of the TV to watch TV shows from the UK. And I learned just hearing people talking English even before to start speaking Spanish. So that's why maybe I got some of the accent, the pronunciation, because as a little kid, it was easier for me to catch the pronunciation and the way that people were talking. So mostly I learned all the slangs and the phrases, the quotes, that people were saying on TV shows.
Oh, wow. And here, I thought you were going to say, well, I studied over here and I studied over here. So, and they say immersion in children, their brains just pick up languages so easily. I'm trying to learn Spanish and my brain is not picking it up very easily.
Well, I'm the living proof that could happen eventually.
One of the great things about having Dr. Garcia is that actually she will accompany you to, if you have to see a specialist who is not fluent in English. And that's something I really appreciate, because she's offered me that service, because one of my specialists doesn't speak any English. So that's a big plus. Dr. Garcia, how long have you been practicing medicine?
It's about 10 years since I graduated from med school, approximately. I was raised, educated, and I did all my training here in monta, Ecuador. So I can guarantee to you guys that in Ecuador we have a wonderful education. Med school is just amazing, exactly as the other tops of the universities around the world and inside our country.
And that's true. That's not just an Ecuadorian saying that, but the just about on every site that does evaluation of countries and healthcare, Ecuador, little tiny Ecuador, about the size of the state of Arizona, is way at the top,
Oh, that's good to hear.
Yeah.
I'm so proud about our country. We're genuinely good and kind people, and we are always open to help foreign people and people inside our country, so that is amazing news for me to hear from you.
Yes, yes. While the U.S. is somewhere from 27 to 40, Ecuador was like from 9 to 15. So way, way up there. And so, like I said, especially for seniors, because when you're over 60, and that's my group, and we just jump right in. I guess I should pause and do the official introduction. My name is Deborah Valerie, and this channel is 60+ Black Women Expats. Now, of course, the YouTube channel, anybody can subscribe, and I hope you certainly do subscribe and comment and ask questions, because then we can, the channel will grow. And if you find the information here valuable, then that will encourage me to continue to make these YouTube videos, because at my age, everything is hard work, okay? But one of the things, and I also have the Facebook group. Now, the Facebook group is Black women only, Black American women only, and that's because we do have special frame of reference. Uh, we do have some Black dysphoria that are not Americans, but that's very few. The group is almost 4,000 now, over 3,500 women from all over the world. Some who have been expats for decades. We have women that are in their 80s. We have women that are in their 40s.
That's so amazing.
So we don't hold to the 60. You don't have to be 60 to join. The reason I named it 60 plus is because our focus is on those who are looking to retire. We're not looking to be gainfully employed or become digital nomads. And our concerns are, because some of the young people aren't concerned so much about healthcare because they're healthy. At our age, there's usually something going on. And for Black Americans, a lot of times it's diabetes or high blood pressure and things like that. So, in terms of the care for diabetes, high blood pressure, and the other expats, what type of care, what do they say about the care here in Ecuador?
So we have two different types of medical care. We have the public system, which is ruled mainly by the government. So we have IESS, which is the Social Security system for people who worked and they are planning to retire at some point in the future. And then you also have the MASP, which is the Ministry of Public Health, who cover basically people who can't afford medical help. So that would be the public system. I work almost 7 and about 8 years for them. And then I decided to start my private practice as I am doing right now. So I can guarantee that the medical attention is very, very good. Well, we are a developed country. We are developing in that process. So our system could be quite slow compared with you guys. I never use the US system, so I can't compare. I don't like to compare.
Mm-hmm.
And we are a little bit load of the staff, but we can guarantee a good medical assistance.
And then you're talking now about
Now I'm talking the public, so
the public,
which
yes. Mm-hmm.
you go and you don't pay anything, and you probably have to pay for the medication, for some medical supplies that police system do not have, but it's generally for free.
Yeah. So that would be equivalent to our Medicaid.
Yeah.
So what she's talking about.
Exactly. So that would be our ISS, and what the government does through the ISS is you pay like a monthly fee, and with that you cover your medical attention. When you stop working, then you receive all of the benefits as a retirement. And then you have like this monthly payment the government do for you, which is like to survive as a retired person.
Yes.
Something like that. And then we have the private, which I belong. I don't belong like in a specific system of private insurance. I'm separate to the private system per se, but I'm a private doctor. It means that my services has some wages that the patient have to afford. So, and I also help patients to claim their with their insurance companies and be paid after they pay me, something like that. So we also have that assistance, that options, which brokers, they offer different types of insurance, and you pay a month fee exact as the other one, but it's something that you hire, and you can even insurance yourself as your health and your life secure. You also can insurance your house, your car, and several other services that insurance companies offer to customers.
So that would be like our private insurance. That would be the
Correct.
equivalent of our private insurance. And so that's what so she's like described our Social Security, at a certain age, you pay a certain amount, and you might have to wait a little while for, and then the private insurance you get in quicker, but you might be paying a little more, you might be paying up front and getting reimbursed.
Exactly.
But in terms of affordability, it is so, it's so affordable to have the private care insurance and to pay. I mean, for instance, um, Dr. Garcia comes to your house for the house visit, and it's $60.
Yeah, I do house calls and my fees change according the location of the patient. So usually when it's a basic attention, me showing up at your house would be $60, and then I charge extra fees according if I offer you different services like an IV pump, an injection, and the administration of meds, special prescriptions. So that will change a little bit. So if it's outside of monta, I will charge you a little bit more because
You're going further.
Yeah,
Yeah.
I'm going further. Correct.
But that $60 is it. That's not $60 out of pocket or $60 deductible, and then there's another bill coming. That $60 is it that covers her visit, and that's the visit. It's not like she's watching her
No.
her watch. I remember when she first visited me. I know you were there at least 90 minutes because she was so thorough in getting all my history and stuff, and there were things that her questioning was so in depth that there were things that I glossed over and she picked up because I was like, oh, I don't have thyroid problem at all. But my mother and my sister did have thyroid surgery. She's like, oh, well, we're going to test that then. And so, you know, she ran the labs, and I paid for the labs out of pocket, and it was just affordable. And now that I have my cedula and I'm a resident, now I'm looking, and I'm over 65, I'm deciding between, I'll probably do a combination of the government for like the,
Existing condition
yeah.
or
yeah.
emergencies.
Emergencies, yeah. And then have the private care where I get reimbursed a little bit. But it's just totally, in terms of accessible. One example that I like to give is when my friend Ursula was here
Yes.
and had a knee a long time knee injury, and the travel had made it worse. And I finally remembered on a Friday evening at 8:30 p.m., I called Dr. Garcia and said, do you think you could see my friend? And she said, what, 9:30 or 10?
Yeah,
And
I
I'm
think so.
thinking Monday. And she's like, no, tomorrow on a Saturday. And I'm, Saturday? Well, how much is that going to cost? But surely it's going to be more than the 60. And she's like, no. And she was there, and she treated her, and then ordered injections, had them delivered to the house, administered them, and recommended her to an orthopedic surgeon who was wonderful. And so I'm very pleased. Ursula's very pleased with the
I'm so glad
health
to hear that. Yeah.
that we got here. So, and Mountain has a brand new hospital, and
They rebuilt the hospital, which is one of the oldest hospitals that Manta has.
mhm.
And the government invest in a brand new hospital from scratch, using the same structure, main structure of the building. And now it has more capacity to attend and solve people's problems. That is exactly and precisely the hospital that I worked before I start my private practice as a private doctor.
Wow. Yeah. So let's go through your work experience. So after your education, you first worked where?
Well, so I graduated in the ULEAM University. It's in the local and the public university here. And after that, I did my internship in the two main hospitals in the province. The half of my internship, I did it here in the Rodriguez Zambrano Hospital. Then I did it's like a small period, like 2 months that you do your practice in the community center.
Mhm.
It's like a walking center, something like that, and a small walking center where you just saw the basic things, very basic things. It belongs to the government as well, And then after that, I finished my internship in the hospital of Puerto Viejo, Verdi Ceballos Valda. After that, they reunite all the doctors they graduate in that year, and they send you to do your community year, which is like the 8th year of the med school. You are a doctor already, you have your certification, your degree, but you depend of the public system yet because they certified afterwards you finish that. They give you like a license. So I worked for a year in a very, very farther spot of Santa Elena province. Julio Moreno is the place. And I had a wonderful year working with people in the communities. We did holistic medicine, ancestral medicine, the orthodoxic medicine, and I had the chance to work with very, very poor people with very important needs. And that was an amazing experience for me. After that, when I finished that, I had my certification and my license provided by the MASP. And then you have to go for a special test that allow you to practice medicine in the public system. That means that if for some reason you cannot have the grade you need, you can work as a private, but you can't work as a public doctor. So I did cross a year perfectly, thank God, and because I just worked so hard, I studied very, very hard for it. I got the license and I started working as a resident in the emergency and the trauma department at the public system. The first almost 3 years was in a primary care emergency room, and then afterwards I applied for the main hospital when I worked like the last years that I practiced as a public emergency resident doctor. I practiced their internal medicine, emergency medicine, clinic medicine, and I was treating also intensive care patients that were frozen by our emergency room. Very critical, very, very delicate and very critical condition patients.
Trauma patients.
Yeah, trauma patients, that's correct. Patients that needed surgery or require surgery, and some others they went for clinic assistance or they were in a life-threatening situation. So the emergency room is one of the best areas I really enjoyed to work there, and that was what I did mostly of my entire career.
Now, when I first opened the door, the doctor said,
I look like
you know,
everybody say
is
that.
this your doctor or is this your doctor's assistant or daughter or whatever? But you just made a birthday.
Yeah, last week Thursday was I just got 36 years old.
36 years old. 36 years old. She said, she tells me she stopped aging at 13, and I said, yes, that is so true. And when she's not wearing her scrubs, one time I had an emergency just before I left for Panama where I needed a script.
Yeah.
And I couldn't get in touch with my therapist. And so she said, well, the therapist had prescribed it so I can do the script for the refill. I'll run by. I'm on my way out of town. And that's what she does. She's on her way out of town for some educational thing somewhere, and she comes by, and I open the door, and she's dressed like a little biker, a hiker, or whatever. Or like she's gonna sell me Girl Scout cookies or whatever. And this is my doctor, and I'm like, it's
I'm a human being. I'm a normal person, so I was doing some exercise, like working out or something like that. And then I just got your phone call, and I was in the neighborhood. I said, okay, I'm gonna go.
Yeah.
And it just put my white coat and it just came out.
And it's so funny because I had to have her on because I have a wonderful doctor in the U.S. Who is very dedicated, and I love her dearly, but I don't have her personal phone number. When I call Dr. Garcia, I don't call her answering service. She is her answering service. I have her WhatsApp number.
I have my own secretary, my own staff. I employ myself. I am my leader and my boss. I'm my everything.
And that's what the Panama and Ecuador is so refreshing to call your doctor and have your doctor pick up the phone and you not have to speak to the receptionist and tell the receptionist what's going on, and then they decide if you speak to the doctor's assistant, and then the doctor's assistant will make a note of it and pass it on to the doctor, and the doctor will call you back within 24 hours or 48 hours. I mean, it is just so refreshing to be able to talk directly to the doctor and then have the doctor call you back and check on you. And people who are in the U.S. are afraid to leave because they think that they can't, that it's the best health care there is. Now, I'm not saying we have poor health care. I'm saying that our doctors operate under a totally different system. They have to pretty much do what the insurance companies dictate they do, even when it comes to writing prescriptions. They're told what they can prescribe by the insurance companies.
Yes.
Now, in terms of scripts here, I had a special situation because one of the medications that I'm on in the U.S., they do not prescribe here in Ecuador, and that's something, as I'm writing my book on how to get residency in Ecuador or abroad, period, it's very important that you find out if your particular medications are legal in that country. I have a friend who is also ADHD and takes Adderall, which is not legal in Mexico. My Vyvanse is legal in Mexico, but Adderall it's not. And so not only could she not have a script deal there, she couldn't have it there. It was illegal. In my case, my particular medication, although not prescribed here, is allowed here as long as it's prescribed by a doctor in the U.S. So as long as my name is on that bottle, it's allowed here. So it's very important because you don't want to get in trouble with customs. You don't want to do anything illegal. You're going to respect that particular country's laws because you are a guest, even though you are a guest. You're here at the grace of the government and you obey the law, just like when people immigrate to the U.S.
Exactly.
So, what has been the most rewarding part of being in private practice since you transitioned to private practice?
I like to mention first that I really enjoyed when I was working as a public doctor. And I got the opportunity to help so many people and to get to know so many people. And right now, the most interesting part, and I just remember my mother telling me this few years ago, that you have to practice your English because you're gonna work with foreign people. It's just like when I'm thinking that, it's like I can't believe it because it actually happened. So she was a very wise woman. So when I decided to move on with the public to the private system, it was a very, very strong change for me because I never performed private practice before.
Mm-hmm.
That because my work, but I had like a very demanded work. Working as an emergency doctor is a very agitated work. For example, I was doing shifts from 30 hours and then probably I rest one day and then I got back like 2 days later. So I was so exhausted and so tired. I loved my job. But now it's like I can manage my time. I can decide whether if I like to work from Monday to Sunday or whether if I want to book all my patients one single day. It's like you have that freedom to book your own agenda, and when you are working for a government or working for an enterprise, you are under day schedule, not books. So that's a good thing, so you can help. I think that you're open to help more.
Yeah.
But obviously, you have to charge your fees.
Yes.
So you can't do it for free because you don't have like an income. Nobody is paying you a monthly fee like you have with the government. So sometimes people do not understand that.
Yeah.
Yeah, and there are some expenses that I have to cover as a doctor. I try to be very reasonable when I'm charging my wages. Because as the situation, the economy, and in the entire world is difficult for everybody at the moment. But also I can get the patients in a very different environment.
Yeah.
I can watch out what they eat, how they live, if they are happy, if they're sad. I can cover much more things that when I was working behind an office, I was very limited with the time. I like to take my time with patients. So it's like I decide whether if I want to be 90 minutes with them, 2 hours with them, if I want to spend the whole day. It's like I can build a good interaction, a good relationship with the patient that sometimes you can't when you are rude and you only can spend 20 minutes with a patient.
Yes.
Which is very difficult for me because
Yes.
I like to dig very, very, very deep in the patient. You're my patient, so you know who I am. So
Yes.
I do a very, very, very meticulous medical history. I go to your history, your family history, your surgeries, your allergies. So the 70% of the diagnosis of a patient is in the interview that you're doing with them. You can catch mental issues. You can
Yes.
catch depression, some other things that it could escape. So it's like you are this, you're doing counseling. They say I'm not a counselor, by the way, but it's like you get to know much more the actual human being, and not only the person that is sick
Yes.
or ill.
Yes. And you're not there just for that allergy.
Yeah,
Or for
you're
that
there for the
symptom.
whole human being.
You get to observe them in their own home setting, which is something just about unheard of in the U.S. except for way back in the day when the doctor used to make visits, probably my grandmother's day, when there was one doctor in town and he made his rounds or whatever. But that's the kind of care, and by her seeing me in my home environment, she is able to pick up a whole lot of things that she wouldn't be aware of if I showed up at her office, because I'm all dressed and I'm going to tell her what I want her to address. But when she's in my home environment, she's picking up everything. The fact that I have a dog, do I have plans, how the things I'm eating, she's just picking up everything, and so she's asking questions about it, and it was just such a thorough first meeting and first basis for her to get to know me and then run all the labs, so she now has a basis for anything I call her. She already knows what to eliminate because she took such a great history.
And also, I don't know if that would be the relevant of what in the United States you call concierge medicine or boutique doctor.
Yeah, sort of like, which is only for the rich. They call them boutique or concierge.
I just don't know. But I'm just like this. I just create a history of my patient that I'm able to share with any specialty. And my language, avoiding you to have to translate your medical history, and then it makes that easy to the specialty to get into the diagnosis. I go to be sure that you will receive the attention, the care that you need, not only as an interpreter. That's another of the services that I offer. So I'm a medical translator. So I'll go as your doctor and as your interpreter, so you will feel like your doctor, the one is your head doctor, is also sharing your history and putting all the attention in what you need, what you're seeking for.
Yes. Because with my therapist, it's very important that she understands what I'm trying to convey, and when we don't speak the same language, it was so frustrating. And I wanted to get to another question.
Sure.
Okay, the living here in Monta, some of the things that we deal with that in the U.S. too, is a lot of the times we don't drink tap water.
Okay.
And so there may be fleas in the water or parasites in the water or digestive issues that most people here do bottled water.
Yes.
And the restaurants to use bottled water and everything like that. But so what would you have to say about people preparing themselves for a transition to live here? Would it be like come and just gorge on all the food at one time, or maybe ease into the local food?
Yeah, so it's important to know that you're coming to a country that a space, a physical space that is very different than yours, than the one that you were used to. So we had different bacteria, different parasites, our epidemiology, which is mainly the infections that there are in our territory are different. So your immune system probably is not effectively prepared to defend themselves against those infections. So for example, our water system is very complex. It's not potable completely 100%. So if you go and you just buy this bottle from the big bottle, the blue one, and you think that water is clean, that's not totally true. So sometimes I recommend some patients to prepare their system for the bugs that they will get in touch with, like amoebas, for example. But what happened is like, and I understand that when the people came here, they got like they can have very like a lot of things very easy out of the counter, but that's not safe because you're self-medicated and you're being medicated by a pharmaceutical assistant that they weren't trained as a doctor. So what they do, and I'm sorry, this is not to criticize or to judge anybody, I don't want to be a judgmental person here, but you always have to seek for a doctor's attention. It doesn't matter which one you choose, but I've seen so many of the situations that they were treated for a bugs that like they are for children, they're not for adults, they're not for amoebas, and they had some schemes that they are not exactly what they should take. So just always part of the preventive care is what I like to focus most. I like to keep people healthy and keep people very organic, good diet, preventive medicine, because we're intoxicating our body with some medications that sometimes we don't need. Pharmaceutical institutions, they are just a big business. And again, I don't want to offend anybody, but it's like we are keeping people sick instead to keep people healthy and keeping them away to chronic and fatal consequences for chronic disease. You know what?
Preventative care.
Yeah, preventative care. But how can you have a preventative care if you just wait to be bored to the death to seek for a doctor's attention? When you should go at least once a year and just go and find out if you're okay in advance, and you can prevent so many things. But people don't pay attention, they don't care preventive, they focus in some other things.
On the symptoms.
And they are not seeing that how I can have this precious life as a retired person if I'm not giving the importance that my health needs. That, healthcare is a priority.
It is a priority.
It is a main priority. You can't dismiss that.
No.
And we mainly dismiss that a lot.
And I think our group, our age group, healthcare is a priority. And so a lot of times we felt stuck because we thought we were getting the best health care, or we knew we weren't getting the best health care, but we didn't know where to go. And so that's why I love my group, because it's women from all over the world, and it's women that look like you, telling you the truth, the whole truth and nothing but the truth.
I don't like to lie like people. I don't like to make promises.
Yeah.
I just go straight forward with the truth. I try to be the kindest I can.
Mm-hmm.
So with love and thoroughness, like things. But like you cannot just put a shadow and cover things that they are impossible to cover.
No. I mean, if they have a problem, they need to deal with it. And one of the reasons I think you will see people from America not see the doctor for preventative care was because we were used to it costing so much. And when you call with an appointment, you had to call with what are the symptoms, what are you, so you had to be calling with a problem, you couldn't be calling to say, well, I want to prevent this problem, because you wouldn't get an appointment. So it's a whole different mindset that we're coming into when the doctor wants to know what you're dealing with at the onset, so that you can prevent it from getting worse to where the treatment is acute treatment or chronic treatment or whatever. And it's affordable. So another thing that deterred us from preventive care was the cost, the out-of-pocket cost, the insurance costs, and everything that we had to deal with. And so it's a pleasant transition to find out if you can see a doctor before things get worse. Like when I called you and I told you I had the rash and bug bites, and you were like, how long have you had it and why didn't you call? And I'm like, oh, why didn't I call? And so we're dealing with that. We're dealing with that today because I was so used to not calling and, oh, I can handle it or whatever. And so it's a transition. Now, in terms of like the different surgeries that are available here, the cataract surgery and cardiology treatments and CT scans and MRIs and stuff like that, do people have to wait a long time for when you say, oh, this person needs an MRI?
So if you go for public system, as I said, well, we are a developing country, so it's quite hard to get things faster. It's very, very hard. But if you go to the private, you can have it the same day.
I know.
Yeah. It's like, it's so sad.
It is sad.
That money has to be in the middle of it.
Yeah. Well, that's the same way in the U.S. too. If you're on Medicaid, you're going to wait. Okay.
So you will have to wait. For example, if you go to the ISS, I always recommend people to have ISS because ISS has good agreements with the best institutions in the whole country. So, for example, if you had a heart attack and you need a catheterization, a treatment to release a blockage to one of the arteries of the heart, so you can be connected with the only hospital. And just randomly put this example through the ISS, and like it's an emergency, it will be quicker than if you go as an ambulatory patient, an in and out patient, I meant to say. But for example, if you go for a private assistance with a cardiologist, probably you will pay in between $50 and $70 per the consultation. That includes you an EKG and a diagnosis, which is very affordable.
Very
which
affordable.
Is not an outrageous amount of money.
No, and that's the total cost.
Exactly, the total cost.
That was the total cost.
For example, I don't know how much it costs an MRI in the United States, but for example, a CT scan of the brain could cost you probably in between $120 and $150. So, and I heard like it's like $1,200. And is that correct? So when I heard that, I was, oh my God, like we are complaining about our country, but things are very, very cheap sometimes.
Yeah, I know.
Compared
You were interviewed on another channel, and he went to Dr. Fernandez and had whole surgery, and he said the entire surgery was $3,500. That included the hospital, that included the surgeon, that included the assisting surgeon, the medication, and he got $600 of that back. And it was, I'm like, what?
So, and also, amazing doctors here. Trained in Argentina, trained in Uruguay, Brazil, Venezuela, very prepared people, even the ones that they got their education here, they are wonderful. They're good. They're the top of the toppest.
Yeah.
So I have wonderful colleagues that I can recommend. I have even my book of the people that have
And that's what I
connected
call
with
her.
people. And
I call her for the refer. I called her and she said,
Exactly.
okay. And she saw her, she assessed her, she
It's
said,
very easy to have an appointment here. It's not such a weird thing like you have to wait until the secretary texted you. So there's not
or
much
the
people
answering
in the
survey.
middle.
There's no middleman. It's like direct. And we had the funniest thing with Dr. Fernandez when we went to see him for her knee. And he's calling us as he's getting out of surgery. And we're like, the surgeon is calling us on the phone. And he's apologizing that he's running late because the surgery took. We normally see the surgeon just before the anesthesiologist puts us under. The surgeon will come in and introduce himself, and you're about passed out, and then you might see him in a recovery where he comes in and he's looking at the thing. But other than that, you don't even talk to the surgeon.
Probably-
It's like way up here.
Yeah, probably there's a big difference between, the technology, and I want to be very, very clear with this. Because obviously the United States, the United Kingdom, and other countries, most English-speaking people or English countries, they are prepared in advance for certain things that we're not.
Mhm.
But it's not exactly the staff or the education. It's like we also need to understand that this is a small country.
Yeah.
And sometimes when I found that patients that they require special attention and that still have the Medicare back in the US, so I tell them just go take a trip and just do that thing. It's not because our country, the staff is not prepared. It's because, as I said again, we are a small country, and if I have to tell a patient like you're going to be better assistant in the US, I would say it right up front.
Yeah.
So
And that's rarely the case because there's a lot of medical furloughs that people take trips from the U.S., from Canada and Germany to come here. When we were sitting in the waiting room, waiting for the surgeon to come, there were a couple from Canada, from Germany, and I think the UK. And because we could understand what they were saying. They were Ecuadorian, and they were all singing the praises of the doctor, and they had flown in, and some had had surgery, some had prevented surgery by seeing
yes,
him.
and people came here to seek dentistry attention,
Oh my
dental
gosh,
work, to surgeries, aesthetic surgeries, cosmetic procedures. They have, I heard from somebody, I can't say the name, but somebody told me that they have these trips, like medical assistant trip, they're like trips. So you come and you just have all the medical that you need, you pay out of the pocket, because it's like
Oh yeah,
more
it's a
than
fraction.
50% less than what you would pay outside.
Yes.
And I've heard that happen also in another country. I think it's from the Middle East or something like that. Because yes, so they right now I guess that medical assistants in the U.S. It probably are very expensive. And
It
if
is
you
expensive.
retire and you have a monthly fee that it doesn't allow you
Yeah.
to barely probably let you to survive with the very basic needs.
Yeah, and see,
Yeah.
I keep and I recommend people because you hear so many stories on YouTube, and people say, "Oh, well, I moved to this country and I dropped Part B of my Medicare." I would never recommend that. There was a specialist on YouTube that dealt with that particular area of insurance for seniors, and she was saying if you drop Part B and you ever go back to the U.S. and need care, you have to, if they allow you back into Part B, they penalize you permanently
Mhm.
for the time that you did not pay into it. And right now, it's about 100, well, it was 170 a month. It's $164 a month. They gave us this discount of $164 a month for Part B, which I keep, because one thing that I found out was the um, the medications that I take there and I take here, they're already, the insurance that I have, the Medicare Advantage plan, over there they're free. Where over here, I have to
So,
buy them.
I always said, like, I like to describe the whole panorama like this. That if I were you, very, with a lot of respect,
Mm-hmm.
if I were you, if I were a U.S. citizen, I wouldn't dismiss the Medicare or the medical system back in the States,
No.
just in case that this country is not prepared to solve
Yes.
what you need. You
Yes.
always can come back and use the U.S. system.
Exactly.
Or, for example, I have this patient, again, I can't say names, so this is private.
Yeah.
But this patient was treated by a very special type of cancer. So he consulted me to help him with the medication right here. But it was so expensive. Like I said to him, like, you still have the support of the government in the United States, or I meant like the security. So just go back there, refill your meds, and come back and live your retirement life, because I understand that you guys move to foreign countries because it's very expensive to afford the life that you can have here as a retired person.
Yeah.
But sometimes these countries, because they are cheap to say, like, to live, we are very limited with what we can solve medically speaking, like some things, like they are more, for example, we sometimes in the public system we have some delays with some procedures that you guys have, like fans. Even the most famous protocols with the heart advanced treatment, you guys have, well, it's written in the protocols, you got certain time to save patients' lives.
Yeah.
Sometimes we can't do that in the time that it should be because our staff is low, we don't have the equipment, we don't have the specialties.
Mm-hmm.
And then in that case, you can always go back to the United States and be treated as you need it. If you have something that can allow you to come back and take the plane,
Mm-hmm.
So, again, if
So
I
you
were
have
you,
Yeah, you have the best,
Yeah.
literally you have the best of both worlds, because
yes.
this month was the first month that I got smart and I was like, wait a minute, I can get this medication free,
In the US.
shipped to me here. And so that's what they did, and I just received and they sent me a 90-day supply because I'm already paying for it out of the Part B, which is why you don't stop the Part B. And so I received a 90-day supply of the meds instead of buying them here and having to pay out of pocket for them here.
Yes.
So it's like the best of both worlds. So I would say, if I had to describe it to someone, and that's exactly what my channel is doing, I would say, seeing the doctors and the attention that the doctors give you, and the time frame, the quickness with which you get in to see the doctors, and the affordability of the doctors is excellent. When it comes to your medications at the pharmacies, they may cost more here than they cost in the
Because
US.
most of those medications are imported
Because they're
medications.
imported, yes.
And they are not, for example, they're another thing that what happens with private insurance. And I really like to provide the whole information, so that's why every time that I have a meeting with a patient, I say, please read properly what you are about to sign. Because like the language is a huge barrier.
Mhm.
So you go and you just sign, you use Google Translate, or you just sign what the thing, and you didn't read the small letters when they're said that they don't cover pre-existing conditions.
Yes.
And like they don't explain what is a pre-existing condition, like high blood pressure, high blood sugar. You have a clearance period and you should wait to use
Yes.
the medical system, because otherwise if you have something related with that, that it would be considered like the
Pre-existing.
the cause was a pre-existing condition. So they won't cover meds, they won't cover attentions, they won't cover labs.
But now there's a time period for that
Yeah,
too.
exactly. But also, most of the private insurers, the majority of them, they don't cover mental illness. They don't cover depression, anxiety, ADHD. So you have to be very conscious and aware about that. You might have to afford out of the pocket because you won't be covered for that.
Yeah.
So that's why it's necessary to read the policies and to ask for the whole information before to make a decision.
And I'm glad she brought that up because I am ADHD and I don't make, it's not a big secret, you know. And that was one of the things I looked into, and you referred me to a psychiatrist, okay? Not a therapist, so, I mean, she has a PhD, okay, psychiatrist, and she was affordable.
Yeah.
She was affordable. And once again, her phone number, you know, not her, not a nurse practitioner. I have nothing against nurse practitioners.
It's directly
not
the
a nurse,
physician, yeah.
but a psychiatrist who normally in the States when I saw a psychiatrist, it was only for her to write script. I might have been in there 15 minutes, and then I spent most of the time with the therapist. Here, I spent more than an hour with the psychiatrist,
Yes.
and then she assessed me and wrote the script. And
Once
so-
I've heard from her precisely
Yes.
that to diagnose properly a patient,
Mhm.
mostly with its bipolar or
Mhm.
schizophrenia or something, the patient could seem like he is perfectly normal
Yeah.
within the first hour.
Yeah.
So that is one of the first mistakes that physicians make. Again, I'm not criticizing anybody, but what I'm saying is like it's very important to interview, to spend time with the patient, because after that hour, the bipolar or the schizophrenic shows up their real true colors.
Yeah.
But
yeah.
you need to spend time with the patient.
Yeah.
So it's like if you're trying to diagnose something, if you don't touch the patient, if you don't take the vitals, you don't touch the belly, you don't hear the heart, the
Yeah,
lungs.
because we've learned to mask it,
Yes.
whatever it is, and that's why they call certain diseases invisible.
Yeah,
Because in order to blend in
Yeah.
with the norm, and we don't go around with a sign saying I'm bipolar or I'm ADHD or whatever, but by spending an hour or so with a psychiatrist, I may have gone in there with high anxiety, or I may have gone in there very calm, but then as she asked me more things, then when she touched the things that I don't do well, like being on time or forgetting things, or you know, then she sees my level of anxiety go
Yeah.
up. She's watching all of that.
exactly.
But what I like is I was talking to the psychiatrist, she was observing me, and it was affordable. And whereas it might have been 2 or 3 steps.
And that's the same way with the other specialties.
Mm-hmm.
I'm a total believer that you create your own reputation. And I really care my reputation as a doctor. And I like to surround myself with people who have the same thoroughness and care for my patients.
Mm-hmm.
Because if you want to make easy money, just go and do something else. But just don't play around with human lives.
Yeah.
That's otherwise just go and find another occupation because you're in the wrong field. Now it's impossible to treat patients like that. That is an irresponsible way to deal with human lives. And mostly when you have a patient who has a mental health that
Yeah.
kills people, that create more suicidal people.
Mm-hmm.
Depression is one of the most dismissed and misinterpreted diseases
Yeah.
because we don't pay attention what the patient is trying to tell us.
Yeah. And our country is suffering greatly because, you know, they keep saying it's more accessible, and it's really not more accessible. It's still hard to get in. It's still very hard to afford, and those people not only hurt themselves, but they kill other people, like hurt other people because they don't get the type of attention that they do.
So that's why I always
desperately need.
recommend like find a GP, a general practitioner. Well, could be me, could be any other doctor. You are the one who has the free will to choose which one you want to see.
Yeah.
And just go for a general checkup at least once a year. That doctor will be able to see the whole panel, the whole body, and then with that information, he could refer you with the right specialty.
Mhm.
But just don't go because you have chest pain directly to the cardiologist.
Yeah.
Because if it's not the heart, you're just missing some other things. So always go to the general and then to the specific.
Yeah. And in the States, we would call that the primary care physician.
Yeah. So that is
she's the primary care.
Yeah.
And then she observes everything, and then you tell her, she's so thorough, she gets out of you what your other needs are, and then she recommends this specialist and that specialist. And I trust her because she's been right on with her diagnosis, and she shows up when I need her. And I mean, the recommendation, one of the things that I liked about Monta, because people say, where did you pick Monta? How did Monta get on the map? You know, we thought it was Panama, Portugal, or whatever. But I interviewed Terry, another one of your patients, and Terry was talking about how there's not chemicals in the meat, and the vegetables are so fresh, and there's not a lot of pesticides used and stuff. It's the little farmers and the produce and the food and the restaurants, and we just kind of have everything here. We have very nice restaurants and very fresh, good food and excellent medical care, excellent dental care. And so I've been looking forward to this for a very long time, to showcase this, because there are a lot of seniors who feel like they are stuck. And I still keep my benefits in the U.S. I will always keep my benefits and my citizenship and my Medicare and all of that, even my banking, because you have ATMs, you just draw the money out of your ATM. And the very good thing about Monta is that we're on the U.S. dollar, so you don't even have to worry about exchange rates or anything.
Yeah, no, because it's the same currency.
Same currency.
Yeah. So Terry, the lady you were mentioning, which is a very beloved patient of mine, so she is the right example of the good preventive care.
Yes.
She's right on the track of the good maintenance of the health, because she cares about her health before she got sick.
Yes.
So I always said that is the example of a patient who goes forward.
Yes.
Like beyond what health means. She's very healthy, she eats very well, she cooks her own meals, she cares about what
she does her almond milk. She makes her own almond milk. I'm like, you make your own almond milk?
That good habits, that health habits, makes a huge difference.
Yeah, I'm the only one. Well, let's see, I'm one of 6 siblings, and me and one other are the only that don't have diabetes. And I don't have diabetes because I saw, if I maintained exercise and I swam and I biked and I ran and I did that. Now I need to start that back up again, because when I got to Monta, I gotten a little lazy. But I have my dog, and so I'm forced to walk at least twice a day. I love being on the water, so I started swimming again, and I get to observe the Ironman this Sunday. That's going to be fun.
Yeah.
But one of the things I looked at, on my dad's side, all of his siblings, including my dad, diabetes led to their death. But I mean, my dad lived to 91 because he was the one that worked. He was a contractor, and he worked out in the sun, and he did the physical work where the other ones had like desk jobs or whatever, and he outlived all 12 of his siblings.
Yeah, and now that you're talking about some people, when I ask them, do you exercise? They say, yes, I walk, because I walk to Mega Maxi to do groceries. I'm sorry, but that's not an exercise, I have to tell you. An exercise means that you're forcing your heart to work out a little bit more.
Yeah.
40 minutes not stopping.
Yeah.
So you have the intention to exercise your body. It's different, like I just walk every day with my dog. That's not an exercise, I'm afraid to say. So your
And
body
she looks like
needs,
she very.
your body needs to exercise. For example, people say like, I don't eat salt, but you eat canned food.
Yeah.
Tuna, preserved food, that has a lot of salt.
Sodium.
A lot of
lots
sodium
of
precisely because they need that food to stay on the counter for a long period of time.
Yeah.
So nutrition is very important.
Yeah. And that's one of the things that
Exercise.
my family would look at me and they would see, look, Deborah's eating sugar and she's pouring salt on stuff. And I said, yeah, but then I was a runner. And so your body loses salt. I was
Exactly.
losing all the electrolytes or whatever.
It's not the same for everybody.
It's not the
think
same.
that your body is different than
Yeah,
mine.
yeah.
I might retain more lipids than you
Yeah.
or vice versa. So that's why you can't generalize.
No, you
The
can't.
diet that works for you, it might not work with me or with somebody else.
Mhm.
So everything is personalized. Don't imitate things that other people does because you think that's healthy. That is a very huge
It
mistake.
is a huge mistake.
Yeah.
I am so glad we had this dinner here. I mean, you see how thorough she was just in explaining
I
the
like to
chair.
people have the information they can be free to choose whether they want.
Yeah.
I am not here to bossing anybody, to criticize anybody.
Because you
I-
can't make them do it. You can only advise them.
I am not winging anything.
Yeah, that's it. Yeah.
I am just winging the resistance of the patients. I want to have the patient on my side.
Yeah.
So I want the patient to understand why I'm prescribing this, why I'm doing this.
Mhm.
Sometimes they focus like, oh, this is so expensive, or this is, but you're investing in your health.
Yes.
You're investing
Yes.
in yourself, which
Yes.
is the best relationship that you can have in your entire life.
You're gonna spend the money. You're gonna
And-
spend it for sickness or for health.
How can you work? How can you enjoy a glass of wine, the beach, the con that you just bought in front of in a con and a beachfront? How can you enjoy that if you don't take care about your health?
I know.
The
Yeah,
health,
yeah.
it's something that money can't buy.
Mhm. Nope.
No, if you're sick, you can have a best condo, the most expensive booze at your house.
You can't enjoy it.
But what you need to enjoy that is something that you don't have because you don't appreciate that. So that is something that I would like to tell everybody. Appreciate the life that you guys have.
That's right.
That is the 50%, I can say even the 80%
Oh, yeah.
of the
And
successful.
especially at our age
Exactly.
level, we cannot afford to make the mistakes that we made in our 40s.
There is always
because
time to
our bodies
change your
does
life.
not recover from those type of
Correct.
bad, I won't even say mistakes because it's usually just bad decisions.
Yeah, so
Yeah.
nobody is perfect.
No.
Everybody makes mistakes. I've done it. I'm a doctor. I've done it. I'm not a perfect person. I'm not like a piece of jewelry of all like to be, to just like everybody. But my main intention here is to create conscience in everybody who is seeing this video
Mhm.
and to just pay more attention of your well-being.
And Dr. Garcia, I am so glad that we didn't give up. I said she's
I
coming.
never give up.
She's
That
coming.
is-
She's coming. I know her. She's gonna keep up with her. And she saw a patient. I mean, she had emergency patients and unplanned patients, but she kept touching base with me, saying I'm gonna be there. And I said I'm gonna be here. Today is your day. This
Thank
is
you.
very important to me.
Thank you
I
very much.
want people to know that they can leave the U.S. And you don't have to move here, but if you visit here, or you do move here, or some people do the snowbird thing, you're not going to be sacrificing good health here. you're going to be improving in a lot of ways the quality of healthcare that's available and accessible. And when I say accessible, I mean you don't have to wait weeks to see your doctor. And you don't have to qualify with your symptoms have to be so bad before you get to see or even speak to the doctor. And that was very, very important to me, and it's very important to our age group. So I thank you so much. We've been on for an hour and 40
Wow.
minutes, and we've had people,
Time flew.
coming and going, and 17 people thumbs up. So they appreciate this, and
Thank you very much. Thank you for having me. It's been such a pleasure. Thanks. Thank you.
so until next, stay tuned because you never know, and put those questions and comments out there because she is my doctor, so I'll be referring those questions and comments to her.
You have my
And,
email address,
yes.
and I have certain patients that if they even contact me before to decide to move this country.
Mhm.
And like for example, they want to know if we have in the stock the medications they need or what are the options for them. I'm always open to text you guys back, to email you guys back. I really like what I do, and information should be there open for everybody that needs it.
So,
So
and
if
will
I
make
got
that
the
available.
information, I will share that. Obviously, I made a word, and I charge for my services like any other human
Very
being.
reasonable.
But yeah, information, it's something that I never denied. I always provide everybody. Information is wisdom, information is health, information
is power.
is power. Exactly.
Thank you so much. And thank all of you for tuning in. Until next time, you just never know who I'm going to interview. And hey, I got the doctor in the house today. And so I think we answered a lot of questions that will put a lot of people's minds at ease who maybe have loved ones who are thinking about moving abroad. And you thought, oh my gosh, that's such a rash decision. Now you see it was maybe the wisest decision they ever made. So until next time, be blessed and don't give up on your dreams. Thank you. Bye-bye.
Bye.
I gotta put my glasses on so I know how to sign off.